All right, ladies, I'm excited. I've got my first pharmacist here on the podcast today. Shawn Needham. Shawn and his wife Janet are both pharmacists and own Moses Lake Professional Pharmacy, which is a specialized compounding pharmacy creating customized solutions to health problems that drug companies cannot solve. The pharmacy educates and empowers patients to take charge of their own health and has done so for over 20 years. To help do this, the pharmacy does not bill any insurance so they can offer better pricing and service to the individual client. Shawn is currently a clinical assistant professor for University of Washington School of Pharmacy and teaches the advanced compounding course. He has spoken on topics across the nation from hormone replacement, innovative pain therapies, and marketing a pharmacy. Shawn has a passion for helping patients achieve optimum health via hormone balancing and nutrition. He loves to spend time with family, snowboarding, hiking, and mountain biking. Shawn is also an Amazon bestselling author with Sickened How the Government Ruined Healthcare and How to Fix It. Shawn and Janet host an ever-growing podcast, Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. So welcome, my first pharmacist, Shawn.
Well, thank you so much for having me on, Karen, and thank you for the introduction. That was wonderful.
Yeah. So Shawn, I follow you now on Instagram and we're friends on Facebook. I was just on your podcast a couple of times, so I will link to that in the show notes. But I see recently that you have some incredible before and after pictures. So you yourself actually have an incredible weight loss story. So I would love for you just to share what you did to have this big transformation.
Yeah, well, it was about 12 years ago. Well, honestly, I need to back up after that, honestly, because so I never really struggled a lot with my weight until I got out of pharmacy school, which would have been almost 30 years ago, 1994. And it was getting there maybe the last few years of college, but I was still not considered obese yet. But then I got out of college and it just slowly kept going on. And there were some weight loss, I'd lose weight and gain it back, lose weight, and gain it back. And, that was starting out in 1994 or so. And I probably started that journey actually of losing weight in 96 or something like that. But then in 2009, I was going to be 40 in 2010. And, my kids were getting to be, more active. And, I wanted to be active with my kids and be able to play sports with my kids and be able to be active with my kids. And I just didn't want to be fat anymore. So I just decided, in December 2009, I'm going to make some changes. And, we had a weight loss program through the pharmacy, and I didn't, I went in to get a physical and all that kind of stuff to get my blood work checked and all that, just so I could do some before and after blood work. And of course, the mainstream medical doctor said, well, we need to put you on blood pressure medication, and, your cholesterol is high and you need to think about cholesterol medication. And he did know me as a pharmacist. So he, respected that I knew about that, but he still wanted to start me on the traditional medications. And, Janet and I had already been exploring quite a lot about, the traditional healthcare system and how, it doesn't manage chronic disease very well, or
At all.
not well at all. I mean, yeah, right. Exactly. Thank you for that. And so anyway, in 2010, January 1st, 2010, I made a New Year's resolution, and, I lost 40 pounds in about 4 months, and, and 56 pounds total over a period of about 5 months or so. And, largely for the most part, I've kept it off for the last, 12 years. There's been some ups and downs. Last year was one of the downs, or I should say ups in weight, but I never let it get out of control like I did before. And so I hit some barriers, or I made some benchmarks and I hit them. And actually last year it was the lightest I ever was. And, let's just not talk about weight, because it's more than just weight.
Yes.
I had more lean body mass and
You know,
less body fat.
you look shredded in his
Yeah,
before and
thank
after. He's
you.
got his shirt off and
Yeah,
he's got his, you know, he's
yeah.
flexing. And I'm like, ah, looking good, Shawn.
Yeah. And I didn't look that good in high school as a wrestler. And,
Wow.
I was lighter than in high school, of course, but, I have a lot more muscle mass now and just a lot and less body fat. So I literally am, I'm 51 years old and I literally am in the best shape of my life. I mean, I'm a mountain bike racer, cardiovascular wise, pulmonary wise. I have incredible endurance and I'm stronger than I ever have been. Now, let me back up on that. That's not completely true because I used to be a power lifter and I'm not as strong as power lifter as I used to be, but I do have more lean body mass. I'm not as necessarily strong on the bench press or the squat rack or whatever, but I'm in the best shape of my life, definitely. And I like to motivate people to let them know that, 50 is not old. In fact, 70 is not old.
No, I
No.
completely agree. 50 is the new 30.
Yeah, right.
Just because my 50 is creeping up pretty quick right now.
Right. I get it.
Did you follow a specific diet then? Like, did you do the program that you guys were offering? Was it ideal protein or was it something like, what did you do to get the weight off in the beginning?
Well, at the time, if you've heard of the diet, it was the HCG diet with,
oh yeah, I've done that.
yeah. And so I did which is a very low calorie diet
Yeah.
along with HCG hormone, which helps to maintain lean body mass and burn fat while you're on the low calorie diet. Now it's a very low calorie diet, 500 calories a day. I was probably more like 600, probably 800, possibly on bad days. But over the long run, it worked for me, and it is important that, that you probably can't maintain that kind of diet for long term. But also this is what I'll tell people when they say, well, is it healthy to lose? Because the first month I lost 26 pounds.
Yeah.
Is it healthy to lose 26 pounds in a month? And the first thing I tell them is it healthy to be fat?
Right.
I mean, that's the most dangerous thing we can do as an American is to be overweight, period.
Right.
There is nothing more dangerous than being overweight. And as an American, statistically speaking, we as Americans are more apt to die from cardiovascular disease, which is largely caused by being obese. So in my opinion, however you can lose weight is whatever works for you is the best thing. Now, long-term, you have to maintain it. There's no doubt about it. And, that's one of the things that we do on our podcast is we talk about different strategies of diet and exercise to maintain, good health.
Yeah. Do you guys still do HCG diet out of your pharmacy?
We don't anymore. That's a
No.
whole other story. Not that I
Yeah.
don't believe in the diet. It's just that the FDA makes it really difficult for compounding.
Oh, it changed it.
anymore.
Yes.
Yeah.
Right.
So,
I forgot about that.
Yeah. March of
2019.
18.
Yeah.
I think we stopped doing it because they just made the regulations. They call it a biological and we were going to have to get a special license. And at the time we were focusing more on hormone replacement anyway. And that's what we do. So we still counsel patients on diet, and hormones are very important to help, part of the puzzle to help lose weight. So we still do focus on health and wellness for sure.
Yeah. It's funny because I've been doing this for so long in the health industry, and HCG was really big, probably about, probably 13-ish years ago here. And there was a bunch of clinics that were doing it.
Yep.
And it actually worked. Like I actually saw people lose a tremendous amount of weight and keep it off for the most part. There were some people that gained it back, but for the most part, people would keep it off. And it was one of the few extreme medically assisted diets that I actually saw work. Not with everybody, but it did kind of do what it said it did, right? Like, because most people, if they just dropped 500 to 500 calories a day for a month, would rebound and gain it all back. And people didn't.
Right. I mean, it's still, there's no easy way to lose weight. And I think HCG diet was a tool to help you lose weight fast. So it's motivating, if you have to lose 50 or 100 pounds, like I had to lose at least 50 pounds. If somebody told you, well, you're gonna have to lose 1.5 to 2 pounds a week. So you're gonna have to do this for a year before you lose the 50 pounds. That's not very motivating.
No.
But if somebody can say, you know what, you can lose 50 pounds in 2 to 3 months, it's very, very motivating, especially if you got 100 pounds to lose. Now, long term, you still, I still have to watch what I eat. I still have to exercise.
100%.
You know, long term, you still have to, you know, maintain a good, healthy balance. That's just, you know, because I tell people now, I can't remember where Jen and I were with somebody, we were eating out, and you know, I mean, sweets are my weakness, and that's why we just don't buy them, because
Yeah.
I could eat a box of Oreos. I mean,
Yeah.
seriously. And I do know, and I know this is hard for some people to believe, you know, because they see what I look like now, and they're like, no, you don't struggle at all. And it's like,
Yeah.
um, I know, Karen, if I stopped exercising and I ate everything I wanted and drank and ate everything I wanted, I guarantee you I gained 30 pounds in a month. I guarantee it.
Yeah. Right. Yeah. Totally. Me too.
No, I mean, really, yeah. And
Yeah.
I
You
just
have to
know,
work at it, right? It doesn't come
and it's, you
easily.
know, right. And it's a constant, I don't want to call it a battle, but I guess it's a lifelong battle, and that's okay. I mean, you know, because this is what I tell people, I don't want to lose 60 pounds again. So I stay within a pretty good range, so I don't have to struggle and lose 60 pounds again.
Yeah, exactly. Well, let's jump into the whole compounding pharmacy thing, because as you know, I'm a certified hormone specialist. I work with women and their hormones all day long.
Mhm.
And I'm the person that just says, okay, here's my recommendations. Here's what is common. You can now go talk to your doctor about this. And it amazes me just how much doctors do not know about compounded hormones. It just goes right over their head. They think
Yep.
it's all wishy-washy and not regulated, and you're not getting an exact amount. And it's just crazy how much they just don't even know. They'll put a woman on birth control before they say, hey, go take bioidentical hormones. It
Or
blows my mind.
give them a hysterectomy.
Or give them a hysterectomy.
Right.
That
I mean,
is so common.
the joke in our industry is if they're less than 40, it's birth control pills. If they're over 40, it's a hysterectomy.
100%.
And that's a joke, but it's really kind of serious. And you talk to women after women, you know, and it's like,
So
yeah.
sad.
And they're like, how do you know that's what he did? That's exactly what he did. How do you know? Because that's what they
Yeah.
always do. If you're less than 40, you get birth control. And it made your problems worse. Yeah. And then finally he said, oh, I got uterine cysts, so give me a hysterectomy. Yeah, we see it all the time. And it's totally unnecessary. But, you know, doctors are not educated on hormones. I tell my staff, even the ones that aren't pharmacists, you know, if it's a staff that's close to me and I'm kind of, you know, that they're learning beside me about hormones, I will tell them, I'll give them like an hour presentation. I'm like, look, if you know these few things about hormones, you will know more than most doctors and most pharmacists do about hormones. And they're like, really? And I'm like, yeah. I'm like, and they're like, well, where did you learn all this? In pharmacy school? No, we didn't learn any of it in pharmacy school. We learned in pharmacy school that it was Premarin. When women need hormones, you give them Premarin, that's it. And you don't need progesterone if you've had a hysterectomy.
Yes.
It's like, oh, okay, well, that's crazy. But, you know, so, you know, most doctors, most pharmacists are educated by big pharma. They're educated by drug companies. You look at the biggest donors to pharmacy schools and to medical schools, they're drug companies. So we shouldn't be surprised that big pharma runs healthcare. I mean, it's no surprise whatsoever. And you know what? I'm not bashing on big pharma totally. They've made some life-saving drugs.
100%.
I mean, there's no doubt, you know. And when it comes to acute therapies, you know what? I've got a nasty infection, a nasty pneumonia, and I'm going to die if I don't have antibiotics. Please give me antibiotics. I get in a car wreck. Please do what you have to do to save my life. I have a heart attack. Do what you have to do to save me during the heart attack. After the heart attack, let me decide what is best for me when it comes to chronic disease management, because they're going to put you on 9 different drugs, beta blockers, aspirin, nitroglycerin, you know, to name a few. And I don't even keep up, and a statin, of course, for cholesterol.
Yeah.
I don't even keep up with what they call the standard of care anymore. Because like my wife says, standard of care does not equal quality of care. And, you know, when I look at our chronic disease management in the United States, it's horrible. Type 2 diabetes, cardiovascular disease, hypertension. I mean, all of those are, you know, lifestyle related diseases.
Yeah.
And we're going to fix them with drugs. Are you serious?
Mm-hmm.
It's just, you know, I mean, they're lifestyle related diseases. So our goal at Mosaic Professional Pharmacy, as it always has been, is to educate and empower individuals to take charge of their own health. And I think what is more powerful than two pharmacists that don't believe in drug therapy?
Yeah, that's crazy.
Right. To treat chronic disease. People can't believe it. And I think that's why it's so powerful because, because we do believe in that. And it goes a long ways. Obviously, we do believe in hormone replacement, but, and I guess you could argue that hormones are a drug for sure. But
Yeah.
when you look at what hormones do to prevent chronic disease, it's incredible.
It's astounding.
And,
Yeah.
it's one of the reasons we have a passion for it, because we have
Mhm.
changed thousands and thousands of lives because of hormones and just balancing people's hormones. And so we love what we do. We feel we're empowered, and we're empowering patients. And, when we were in the old model of pharmacy, 20 years ago, and we were dispensing, finally, there's a story in my book that I wrote, my book called Sickened, How the Government Ruined Healthcare and How to Fix It. There's a story that Janet shares in the book. She wrote the foreword in the book. And the thing that changed our lives was when a 50-year-old patient, and, we were just talking, I don't know if it was on the podcast or before the podcast, about 50 not being old. And it's not, I'm 51 years old,
Yeah.
and I don't feel as old at all, but this patient was 50 some years old. She weighed over 500 pounds and she was dying. Yeah, it's horrible. And she called Janet and she says, well, I just want to let you know that this is it for me. And we were dispensing 20 different medications for her for everything, diabetes, hypertension, cholesterol, just name it, whatever disease you want to pick that's lifestyle related. She had it, and then drugs to treat those side effects from those drugs. And
Oh my gosh. Yeah.
yeah. And she says, I just want to let you know, I ate myself to death. And,
Oh,
yeah, it's
it's
very sad.
heartbreaking. Yeah.
Yeah, it was. And Janet realized and discussed the story with me that, we're just enabling people,
Mhm.
and honestly, I believe that pharmacists and doctors out there that are just dispensing medications, for another disease state, you're just enabling them, and then you always get the pushback. Well, people don't want to change their lifestyle. So they just don't have time to do that. You know what? That's a cop out.
Yeah.
That's a cop out because you don't want to take the time to educate them. And believe me, if you think they're not going to change, you're right.
Yeah, exactly.
I mean,
So I do have a question. Do doctors get like a kickback financially if they prescribe a birth control pill over a compounded hormone replacement?
well, I mean, there's probably some things I don't know that goes on inside, but I would like to give them the benefit of the doubt. First of all,
Okay.
that is, if it's not unethical, it's at least unethical. And in most states, maybe federally, it's illegal. I don't know for sure.
Okay.
But let's just think about it this way. And, I know for years, the pharmaceutical companies would spend, thousands of dollars to say, hey, doctor, if you go on this cruise and do a couple education
Yeah.
seminars, then, then we'll, and educate you on our drug, then, the doctor's going to probably prescribe it. And I understand that. So direct kickback,
Incentives. There's
yeah,
incentives. Yes.
there might be incentives. And here's one of the things, Karen, and it's no different than all of us. All of us can be influenced by the people that are in front of us day to day. So
Yes.
if a drug company spends billions of dollars on marketing to a doctor and they send those drug reps out there day in and day out to get in front of these doctors, I mean, eventually the doctor's going to probably say, oh yeah, I'm going to try this, so, and I don't necessarily, I mean, I guess I don't know how to word it. It's like, I do fault the doctors somewhat, because they're not taking the time to educate themselves, especially when they look at, most of the new drugs that come out in the market. I mean, Janet and I were in a restaurant the other day, and we don't keep up with the way we find out about the new drugs is we see them on TV. And we see, you're right. And we see this new statin, statins are notorious for being prescribed for cholesterol, a brand new brand name statin on the market. And that's all we need is another drug for cholesterol. Let's see.
Yeah.
Mevacor was the first one that came out, lovastatin, 30 years ago. And it was supposed to prevent heart attacks and strokes. Yet cardiovascular disease is still the number one killer of Americans, and it's going up every year.
Yeah.
So I don't think it's working.
I don't think it's working. No.
Why are drug companies bringing out new drugs? And why is the FDA approving them? I mean, and the answer to the question is money. I mean, I get that. And here's the thing. I'm a capitalist. I've got nothing wrong with anybody making money.
Yeah.
Here's what I want to do as my job as a pharmacist and a patient educator is just to educate patients to make their own choice.
Yeah.
And I think doctors should do the same. And I think pharmacists should do the same. And I don't think they do a very good job of it most of the time. They're just, they just believe everything that's said and out there. And I will tell you, I was guilty of that. And I got to tell you, Karen, I rethink my whole pharmacy education in pharmacy school.
Yeah. Yeah.
Because we were just lied to a lot.
I always just tell people, like, you got to quit counting on your physician to have the answers to what is a holistic treatment or bioidentical hormone therapy, because they're just not taught that in school. They're there to say, here's the best drug for that symptom. And we have to, unless they go out and they educate themselves, like you said, like extracurricular education that they're paying out of pocket for to go learn about bioidentical hormones, guess what? They just know to say, here's your birth control pill, here's your Premarin. And we can't really get too angry about that, because that's what they're taught. That's their job. It's not their job to know holistic treatments and dietary interventions. I wish it was, but it's not.
Right. Well, and I feel one of the goal of our pharmacy and the goal of our podcast and my book, there's a 6-step solution in my book about how to fix the healthcare system. I mean, I think a lot of people will understand and even complain that the government did screw up healthcare. We hear about it all the time.
Yeah.
But what makes my book different is it does have a fix in there. And on chapter 6, it talks about a 6-step solution to the fix. And the number one solution is to educate and empower people to take charge of their own health.
Yeah.
It's not the doctor's responsibility. It's not the pharmacist's responsibility. It's definitely not their insurance company's responsibility. It's definitely not the government's responsibility, and they need to do it as an individual, and they're the only ones that can do that. So, and you know what? You can find pharmacists, you can find doctors that can help you through that process, but ultimately you're the one that decides what kind of health you want to have.
Yeah. Okay. So let's break it down, because a lot of people listening are going, well, what's the difference between a compounding pharmacy and a regular pharmacy? Why am I going to go to a compounding pharmacist? And I'll just tell you my own story is 20 years ago, changed pharmacies and started going to a compounding pharmacy and never looked back. And it got to the point that I would actually enjoy going into my pharmacy to go pick up my prescriptions, because the pharmacist was so great. And even with we have 2 compounding pharmacies, even the other guy, same thing. They were exactly like you. They were all about holistic. They talked to women about bioidentical hormone therapy. They did great weight loss programs, and they had supplements that they would compound that had all this like natural stuff in it. And actually, 2 of the most powerful drugs that I've ever taken were from compounding pharmacists. One was to treat migraines. So it wasn't a prescription. It was something that they compounded. And I still use it to this day for chronic migraines. And it's the only thing that works. And this is over triptans and everything else.
Yeah.
This combination works. And then the other one they did was a GERD formula, which is for like heartburn and things like that, ulcers. And you cannot find anything on the supplement market that had these ingredients in it. And it fixed my ulcer in a couple of weeks after being on medication and trying all these things from my doctor. So I am a massive fan of compounding pharmacies. So tell us, what is the difference between a regular pharmacy and a compounding pharmacy?
Well, I mean, we can go into general, we can go into details, and that's a broad definition when you call it a compounding pharmacy. And I have mixed feelings about that. And when I talk about the definition of compounding, I use the simplest definition. When I teach the advanced compounding course at the University of Washington, I use the simplest definition with my students. What is the definition of compounding? The simplest definition is to mix two or more substances into a finalized dosage form. Okay, that being said, every pharmacy compounds.
Right.
So the minute they put water into an amoxicillin suspension for a kid, that is compounding, period. I know that the FDA will argue that. I know that state boards of pharmacy might argue that, but it is compounding, period. And there is no way around that. Every hospital, when they make an injectable and they put sterile water into a powdered form of injection, ceftriaxone, that is compounding. So every pharmacy compounds somewhat. Now, let's go into some little history of compounding pharmacy. So the drug industry, the big pharma, the big drug industry is really only about 70 years old. So there were some laws that went into effect with the Legend Drug Act in like 1950 or so, where it basically made big pharma really take off. So in the 1950s. And I was fortunate enough to work with some pharmacists when I first got out of pharmacy school that had worked pre that law. It was way different. In fact, most pharmacists did patient-specific stuff and a lot of compounding back then, just 70 years ago. So compounding is nothing new. We're just getting back to our roots. Traditionally, pharmacists have been taught in the pharmaceutical sciences, chemistry, pH, compatibility, things like that for years. We are the most trained in that science. Now, I will say over the last 20 or 30 years, even when I was in school, they were really pushing clinical pharmacist. And because pharmacists were just going to do clinical stuff. Well, here's the reality. A nurse can do clinical stuff. A doctor can do clinical stuff. Lots of people can do clinical stuff, but largely only pharmacists are trained to compound. We're the only healthcare professional that is. So I think that we should embrace that. I think it's the past, the present, and the future of pharmacy. It's something that can never be taken away from us. Let's hope. Mm-hmm. And I'm also a believer that, my clinical pharmacy experience, when I see all these people that are supposedly going to do clinical experience, in these clinical atmospheres, where they go to Rite Aid and they go to Walmart and they're going to do clinical stuff. It's like my clinical stuff, when I educate doctors and patients all day long on hormones, that's my clinical pharmacy. And the reason I'm able to do that is because of my experience in compounding and knowing how to make up dosage forms specific to an individual patient. So that's where we get into more of the details. So that's the history, the general term of compounding. But as a compounding pharmacist, we can make up individual dosage forms, whether it be a cream, whether it be a sublingual tablet, whether it be a capsule. We focus on hormones mostly, but we can make up all different kinds of dosage forms to deliver a medication to a patient. And that's something that a drug company will never be able to do. Drug companies make up thousands and thousands of doses of a drug, and they don't know their final patient. They have no idea who it's going to be. So the difference between a pharmacist and a drug company is that we know our individual patient. So we work with an individual prescriber and have an individual patient. There's a triad there: pharmacist, prescriber, patient. Drug companies don't do that. And there are certain things that drug companies will never, ever be able to do that a compounding pharmacist does. And I mean, they try all the time to copy us when they find out that we've done something really cool.
Yeah.
There's a list of, I could name 20 different drugs that they've copied that compounding pharmacists really initiated, and they try to copy them. But the reality of it is they don't work for a specific patient. So, and that's what we do. So I love what we do. I wouldn't be a pharmacist if I was a traditional pharmacist, dispensing medications and collecting copays. No, thank you. Janet and I decided we want to do something different, use our pharmaceutical sciences, use our clinical knowledge, and talk to patients and educate patients and doctors all day long. We love it.
So do you work with the doctors? Because as we were saying before, doctors aren't trained in bioidentical hormones. So how do they know what to prescribe for that patient that is then going to take it to you?
That's exactly what we do. So we educate doctors all day long on how to prescribe hormones. And our goal is to work with them, find a new doctor, find a new prescriber, work with them until we kind of, until they kind of feel comfortable to do a general patient on their own. And then they call us for more problem patients. That's what we do all day long, is we teach doctors how to prescribe. And that's what a pharmacist should do. I mean, when you look at what most pharmacists do at your local Rite Aid or your local Walgreens, and they're counting and pouring pills and collecting copays. That's really all they do. Sorry, pharmacist colleagues out there, but it just is what it is. And you guys have choices. So, that's largely what they do. They're totally overeducated for what they do.
Right.
You know.
So for women that don't know, so in most cases, if you were to actually get hormone replacement from a doctor, you have a very limited choice, especially as far as dosage goes. So the highest dosage, for instance, that I've seen for estrogen replacement, when it's bioidentical, which is estradiol, can come in a patch, a vagina suppository, or a vaginal ring that lets go of some estrogen inside the vagina. I've never seen anything as of yet, at least in Canada, that is over a 1 milligram dose per unit. Is that true? Or is there?
Yeah, well,
is there more than that? Is there one that carries more?
Not that I know. Not that I know off the top of my head.
Not that I know of.
And
yeah.
What's really interesting, Karen, is you bring up, Estradiol, for instance. Well,
0.75.
Yeah, and Estradiol is a fairly new. It's been out for only a few years, actually. And I think it's interesting because compound pharmacists have been making up topical estrogen gels for years. So there's a perfect example of how a drug company, the drug companies have a 99% of the business. It's not enough. So they wanted to take that 1% that compounders have and make an estradiol. Here's the problem with anytime they put something on the market. It's not for an individual patient. The dosage is very limited. So what if that estradiol dose is not enough? What are they going to do? They're going to use, 2 or 3 pumps, and then it gets to be a lot of volume, and it's not very convenient to apply. So, and then usually they're incredibly expensive, and it has nothing to do with quality. It just has to do with, usually they're hoping insurance will cover it. So they'll charge $300 a month. Whereas, our estrogen gel is $75 for 3 months. So
that's cheap.
Yeah. Without insurance, very, very affordable.
That's not what it is here. It's 75 for the month for estrogen from a compounding pharmacy.
Yeah, usually our prices are about 1/3 of what most compounding pharmacies are. We compete nationwide with pharmacies all over the nation, and we know how to be competitively priced. And that's what people typically tell us, like, well, our compounding pharmacy charges about 1 month is like a 3-month supply of yours. So we've been doing it for a long time.
Can you ship anywhere in the States?
We're licensed in 4 different states now. We're looking at getting more. But
what are those states, just so people?
Washington, Idaho, Oregon, and South Dakota.
Okay. So they would need their doctor to write in a prescription. They could get it to send into you, and then you could ship it to them?
Correct. Absolutely. We do it all the time. 85% of the business that we do is we ship, and we talk to all of the patients that we ship to. So they get to talk to usually one of the pharmacists. Usually it's probably Janet. Yeah. And we make it really convenient for the patient. There's no transparent pricing. So we don't bill any insurance. And the reason we don't bill any insurance is because we can offer a better price that way. That's why our prices are so competitive. And it also lets us offer better service, no prior authorizations, no surprise bills. You know exactly what you're going to pay when we tell you. And, we ship it out in a couple of days, and you get it a couple of days after that. So we make it very convenient for the patient when there's no insurance involved. And you get the dose that your doctor prescribes instead of what an insurance company approves.
Yeah. And so when it comes to that, what do you see being a typical dose for estrogen and oral progesterone and testosterone? Do you tend to go over what pharmaceutical brands are producing as far as dosage?
Well, I mean, that's a very general question.
Yes, it's just kind of like, if you just find that it seems to be over 1 milligram a day for women when it comes to estrogen. So then it's beneficial to go to the compounding pharmacy?
So one thing with the progesterone is our most common dosage is probably the 150 milligram capsule sustained release progesterone. I like sustained release progesterone that we compound up because there's a commercial available progesterone, but it has peanut oil in it.
Yeah.
And it is immediate release. It only comes in 2 doses, 100 milligram and 200 milligram.
That's Prometrium, correct?
Correct.
Yeah.
And a generic of it, which it's fairly inexpensive now. But I like the 150 milligram because and I like sustained release because it's peanut oil free and it's slow release. So it releases slowly throughout the night when you take it at night, kind of mimicking how your body produces progesterone. We see many women that will switch over from ours to go to the commercially available one. And they'll say routinely, I'm coming back because I wake up at 2 o'clock in the morning with hot flashes.
Right.
Dozens of patients we've heard that with. And as much as they wanted to save a few dollars or they wanted it covered in their insurance or whatever, they come back and pay cash a lot of times because the slow release is a better product. So that's probably the most common dose of progesterone. With estrogen, one of the things that makes us different as a compound pharmacist is we use Estradiol along with our Estradiol. And there's some controversy, and you can argue both sides and if Estradiol is beneficial or not. But then again, let's remember that there's traditional doctors out there that don't think progesterone is beneficial if you have a uterus, if you don't have a uterus. So as pharmacists, we have to be able to argue all kinds of different dosage forms and the ways doctors prescribe, because they're all a little bit different. So I'm a big believer in Estradiol. It is not commercially available anymore. It was in the 1970s, and it was taken off the market, not because of safety issues or concerns. It was just taken off the market because of financial. It wasn't doing well enough. And that was probably a marketing issue. But Estradiol is the #1 prescribed estrogen in Europe.
I didn't know that.
Yeah. So Estradiol is the one that's probably the most of the studies has been done with, but I like to combine Estradiol with it. Estradiol is a weaker estrogen, and it will help to prevent it. So it binds weakly to the estrogen receptor, which can decrease the side effects that estrogen can cause. So Estradiol can cause proliferation of uterine tissue, proliferation of breast tissue, and the way Estradiol binds to the alpha receptor more specifically, it can prevent some of the bad side effects of the Estradiol. Now, the most important thing is when you're taking any kind of estrogen, you should also be on progesterone. If you're on estrogen at all, long-term, you need to be on progesterone.
100%, yeah.
Yeah. So another benefit of Estradiol, when used topically, vaginally, it is awesome for atrophic vaginitis, basically vaginal dryness. It is awesome to prevent urinary tract infections. It is awesome to prevent urinary incontinence. I believe every postmenopausal woman should be on some kind of estrogen vaginal cream. I'm partial to Estradiol because it's specific to vaginal and bladder tissue and doesn't cause some of the side effects that systemic estradiol can cause. So
the estriol is 1,000 times more present in the vagina tissue than the other 2 estrogens. So we produce most of it when we're pregnant.
Right.
But so it's the weakest form of estrogen, best for lubrication. And I tell women all the time, like, if you've got vagina atrophy, you should be on some estriol, especially ones that go right up into the vagina, because women love it. It's like night and day.
It's amazing. I love counseling women on that cream. And we've got a great video on our YouTube site, the Moses Lake Professional Pharmacy YouTube site, just on Estradiol. And I love giving that to women because I will tell them, it's like, look, I don't usually make guarantees, but I will guarantee you in 2 weeks, your symptoms will be gone and you will love this and your husband will love it. It's incredible. And one of the things is I have to remind them too, that, if you don't want those symptoms to come back, you will use this for the rest of your life. Great news is it's affordable. You use it 2 to 3 times a week. There's hardly any side effects, and it's incredible. And I try to get women started off early because usually the first symptom they have is vaginal dryness.
Yes.
But I also warn them, if you don't start this now, you will get chronic urinary tract infections and you will get urinary incontinence. I guarantee it. So the great news is you don't have to get any bladder sling. You don't have to take any drugs that are going to cause side effects. You don't have to take antibiotics for the rest of your life. You just use vaginal estrogen cream for 2 to 3 days a week, and your problem's solved.
Yeah,
So
100%. Yeah,
yeah,
I couldn't agree more. And estradiol, I do find in the right dosage will eventually help with the vagina tissue. It will convert down into estriol. I personally prefer straight estradiol. I used to do a bias and do 50-50. And I just wasn't getting, I needed more. My body loves estrogen. So it was like,
yeah,
I needed to have the heavy hitter. I need estradiol. And it does convert into the estriol partially. And so I feel the difference there. So it's great. But I just had a woman in my group who has tried to go on estradiol twice. And each time she just blows up. She gets water retention, her legs swell, it freaks her right out. And I said, look, we'll put you on some supplements. And then in like a couple months, I want you to go back and I want you to do an 80-20 and do 80% estriol and then 20% estradiol. I said, because it's too much for her and
yeah.
her body. And I said, so try this nice weak form of estrogen that's still going to react on the receptors and still give you a lot of the benefits that estrogen gives you, but it's just going to be a little bit more quieter.
Yeah, yeah. And I that's what's nice about being able to compound is that, you can do a
Yeah.
50-50 ratio, 80-20, 70-30, whatever is needed. But I always do like a little estriol in there because I think women do better with some estriol. And I almost always, if it's a topical cream that women prefer, and even if it's a biased or, or even if it's just plain estradiol, I always recommend, almost always, that they apply it vaginally. And the reason why is because for the obvious benefits we just talked about, but also the vaginal tissue is a great way to absorb drugs. It's better than the oral form. It bypasses first pass through the GI tract and the liver. And, it's a mucous membrane. So you've got good blood flow, thin skin, great absorption, probably better absorption than if you put it on your arm or inner thigh. And you get local effects too. So it's just, if they're using some kind of estrogen cream, I recommend vaginal almost all the time, as long as they're comfortable with it.
Right. Yeah. And you can get it like the ring is a little bit easier. It's not a compounded, but it's not as messy as the cream women
Yeah.
find. So there's different ways that you can get it in there, whether it's suppository and like you get these little applicators where you push the cream in, correct?
Yep.
Yeah. So
Yep.
there's different
Yep.
ways of doing it. So you do find that if it's delivered through the vagina, that you do see the systemic levels coming up, because there's controversy about that.
Absolutely.
Yeah.
Absolutely. And I can explain that a little bit. Let me talk about the applicator also and some of those delivery
Mhm.
devices. So here's one of the problems with, like, there's estradiol tablets commercially available. And my wife and I just almost, we almost snicker when it comes to estradiol tablets. I'm not saying they don't work for some patients, but drug companies are not very smart people. They used to 70 years ago, before pharmacists taught drug companies how to make everything 70 years ago. So they used to be a lot smarter, but now they're not. I mean, Prometrium's a good example. I mean, why would they use peanut oil as a delivery device?
Yeah.
Dumb,
The most like
dumb.
highly food
Right, right.
allergen that's out there.
So, I'm not a woman, but I have a wife, and I have a lot of women that I've talked to about it. But can you imagine having vaginal dryness and trying to insert a tablet and make it dissolve, and you already have vaginal dryness? Does that make sense?
No,
No, no.
no.
And the ring makes a little bit more sense, but still the same issue. You've got some sensitive tissue, and that's why I like a cream.
Yeah.
And honestly, our cream, we dispense with an applicator for everybody, because like 1% of the people use the applicator. But I will tell you what we tell most patients and what gynecologists and urologists tell most patients: don't use the applicator, because they can get contaminated and they can irritate sensitive tissue already. Just apply some to your finger and apply it to the inner and outer labia, and it will work for the urinary incontinence, the UTIs. It'll work inner and outer. It works fine. And I know some people are like, hard to believe that, but they do not have to insert the cream. And obviously, if you've already got vaginal dryness, it's pretty easy to apply there's probably no easier way and better way to deliver a drug than a cream that's already a little bit moisturizing than a tablet or a ring or even a suppository. So that's
True.
why I love estradiol vaginal cream. And you don't have to use the applicator. You
Yeah.
just don't.
Yeah, I've heard of women. It's like I had one that her vagina had literally like that's the way she put it was that slam shut,
Yeah, right,
So
right.
yeah, how are you going to get something in there?
Yeah.
So putting it on the outside and the ingredients in the cream, are they usually pretty clean because we are getting into that sensitive
Oh, for
tissue?
sure.
Yeah.
Absolutely. Yeah. And so we'll commonly, answer probably a few questions a week, maybe a few questions a month. And women will say, well, I think I'm allergic to this cream. I applied to my vaginal tissue and it's just irritated. And our first thing is, well, you can't, it is not supportive of life to be allergic to estradiol. So you can't be allergic to estradiol. And the cream that we use is hypoallergenic. So, we used to years ago, we'd say, let me send you a little bit of the cream and we'll see if we'll give you some different samples of the cream and see which one you're not allergic to. But it's not an issue that you're allergic to anything in the cream or the active drug. That tissue is so sensitive, and it's been that way for so many years, that anything that touches it is going to irritate it. So apply as little as you have to, and maybe only do it once a week for a while, and then work up to twice a week or whatever, and it will work. We almost guarantee it. And we'll sometimes get a question too that, well, I think I'm allergic to this cream. Well, and we'll look at their chart and it's like, well, it looks like you had it 2 years ago. Well, yeah, I quit using it and now I use it and it's starting to burn. Well, yeah, because you quit using it. And they're like, oh yeah, you're right.
Yeah.
Well, okay. I mean, so, and yeah, and talking about her vagina slammed shut. I mean, a lot of times these women, sex was so painful, they couldn't have sex, and it's horrible to think about it, and how some doctors reacted to it. They'll tell the patients, "Oh, it's just getting older. You just got to deal with it. Sex
Yes.
isn't as important when you get older. You know what? Then go to a different doctor."
Yeah.
And I hope that doctor's not married. And if I was his wife, I would not be very happy.
No.
No. So anyway, you don't have to put up with that. I mean, you don't. You do not have to put up with a dry vagina. We have people in their 90s on estradiol vaginal cream, and one of them, when she was 89, called me and said we saved her life because she could now go across town without wetting herself. So she can drive across town. She finally found a urologist that would prescribe something that that it's going to fix the problem instead of treat the symptom. She was prescribed all these drugs to try to treat this, and they'd cause dry mouth and dizziness. And no, what do they lack? They don't lack a drug. They lack estrogen.
Yeah.
Estrogen.
Yeah. And estriol too, in the research, has been the one that shows how great it is for your face, for anti-wrinkle, and to bring plumpness to the face and produce collagen. So Shawn, do you guys have a face cream, a hormonal face cream?
We do. I talk about it every once in a while, especially when I see a dermatologist, which I don't call them dermatologists very often, but we do the same estrogen we use for atrophic vaginitis. We label it different, but it's honestly the same cream that we use for face. Honestly,
a little up here, a little down there. Everybody's happy.
Right. Because it does. Estrogen stimulates collagen, so it's great for wrinkles. So and that's why it works such good for atrophic vaginitis, because it works to stimulate. One of the ways it works is to stimulate collagen. So it's a great drug.
Well, yeah, I use Biest on my face and my neck and my chest. So I have that there. I have a patch. I've used the cream, the compounded cream. I've tried it all, but it's good to just not be put into a box. Like every single one of you that are listening, you're going to need something different. You're going to need different dosing. Some people will need different application. I've had some women that they just won't absorb the hormones, and so they need to do injections. And they swear by them and they think it's the best thing ever. And then other women are like, oh my gosh, no, I gained 50 pounds when I tried that, or whatever. Right. But every person needs something different. So Shawn, do you guys offer hormone testing yourself and do consultations, or no?
We do a lot of consultations. We don't do much hormone testing ourselves. We have the capabilities of doing that, but we rather would like to refer them to a doctor or a prescriber that can work with them and do the testing in their office, and then go over that with them. And then we work with them on creating a customized hormone dose for them. So, Yeah, but that's what we do. We refer patients to certain providers, and that specialize in hormone placement. So,
All right. So how can people find you and get connected with you?
well, we're at Moses Lake Professional Pharmacy, so mlrx.com. Go to our YouTube site. There's over 800 videos. Moses Lake Professional Pharmacy YouTube site.
Where's
Our
Moses Lake?
Moses Lake, Washington, in the middle of
Washington.
Washington
Thank
State.
you.
Yeah, and we also have our Health Solutions with Shawn and Janet Needham podcast. If you just Google that, that'll come up. But you know what, Karen, we did not talk about testosterone, and I think we should really mention testosterone really quick, if you don't mind.
Yes. I mean,
Yeah.
I'm trying to respect your time here, Shawn.
Yeah, I get it, and I really appreciate it.
Testosterone is massive.
But I don't want to forget about testosterone, because testosterone is typically, we think of testosterone, we think of men, but women, testosterone is very important in women, just as important as it is in men. We just need a lower dose in women than we do in men. So women, if you're afraid of testosterone because you think you're going to get big muscles and grow a beard and all that, no, don't worry about that. If you have the right dose, none of that stuff's going to happen. So we talk about some of the benefits of testosterone. One of them, along with estrogen and progesterone, is for bone health. And osteoporosis is a very debilitating disease. And the way to keep your bones strong is testosterone. There is not a better hormone, there is not a better drug to treat osteoporosis than testosterone, period. I challenge any doctor, I challenge any healthcare professional, anybody that wants to challenge me on that. I would love to debate that, because testosterone is the best bone building drug there is. So, but it also helps to maintain lean body mass. It also helps for mood. It also helps to keep our cholesterol and lipids healthy. So for cardiovascular protection, talk about atrophic vaginitis, testosterone. Think about atrophy. We think about testosterone. I love testosterone applied vaginally, because it's absorbed systemically and it has local effects, just like the estrogen does. So I love testosterone vaginally. There's other dosage forms we can do, sublingual tablets, even capsules. But testosterone, do not underestimate the power of testosterone when it comes to women. So,
do you have a lab value that you like to see women in perimenopause and menopause get to for testosterone?
Yeah. So, depending on which doctor I'm working with, and I'll kind of feel them out, unless I, hopefully I already know them a little bit and stuff, how comfortable they are. I like to see the upper range of 50 to 60. But I will tell you,
of total testosterone. Wow. Okay.
But I will tell you,
hefty.
Yeah. And I might, if they're not comfortable going that high, I'll say, okay, well, let's get to at least 20. But I will tell you, labs are a tool to go along with symptoms and history.
Right.
And I will tell you, many women do better when they have a level of 200. And they
don't have
they don't have side effects of oily skin or acne.
Here's Shawn, I just was listening to these guys talk about testosterone, like steroid use in women, and they were talking about how the one guy was like, yeah, I knew a woman that had a 3-inch clitoris from taking too much testosterone. And that was around the levels, like 200 plus.
I got to tell you, right. Well, I don't normally see that with 200, but and there are women that are bodybuilders, and they use insane doses of testosterone, and they have, what's the clinical term? Clitoral right?
Yes. Yeah.
I was at a presentation once. This is just kind of on a side note. I was at a presentation once. I'm kind of a smart aleck, as you might be able to tell.
Yeah.
And I get cynical with hormone replacement, because so many people are just undereducated in it.
Yeah.
And I was at this, and it was a pretty conservative doctor talking about testosterone use in women. And she was talking about how you got to be really careful, because, they can get in a large clitoris. And she used some clinical definition, and I don't even remember what the number was. Let's just say it was 2 centimeters. Okay. Anything over 2 centimeters and it's clitoral amegaly. I just had to ask the question. Excuse me. So what's the definition of when a man uses testosterone and their penis gets too big? Is there a clinical definition of that? Yeah. The room went silent, but then we just realized, like, wait a minute. If this gal is doing better, she feels great, and she has a little bit enlarged clit, okay,
Most women actually like it. Yes, because
Well, I will
it
tell
gets
you
better
from,
sexual satisfaction.
it does. I will tell you,
We don't
women,
need to grow a penis from
no,
our clitoris, but a
but,
little bit of enlargement can go a
and
long ways.
absolutely. And I will
Yes.
tell you from treating thousands of patients, they love it, and they have better stimulation. They have a better sex life. And so honestly, I mean, really, let's make sure they feel good. I
Yeah.
mean,
Don't
quality of
forget
life
about
is important.
testosterone.
Yeah.
It's
Yeah. So,
harder to get, unfortunately. Like men, you guys have like testosterone clinics by the dozen. It's crazy, thousands, whatever, but
yeah.
they're everywhere.
Yeah.
Not for
It's
women. It's
not,
hard.
not
You
for
can't.
testosterone for women. No, but you know
Yeah.
what? If you find the right people, you can do it. And that's why, people reach out to us, and we let them know where they can
That's
find
the other
support.
thing. If people reach out to you, will you be able to tell them what doctors
Yeah,
you
absolutely.
work
Yep.
with? Okay.
Absolutely. Yep.
Yeah. Awesome. Okay, Shawn, let's respect your time because I know you got to go. Thank you so much. This has been awesome. And I'll have to have you on again.
All right. Thank you
Thanks,
so much,
Shawn.
Karen. Pleasure is mine.